Hello, everyone. Bonjour à tous. Welcome, and thank you for participating in today's press conference, which will provide an update on the COVID-19 situation as well as an update on the vaccine rollout in Canada. Today's press conference will also include the National Advisory Committee on Immunization's updates to its statement on recommendations on the use of COVID-19 vaccines. Bienvenue à la conférence de presse d'aujourd'hui qui donnera une mise à jour sur la situation de la COVID-19 au pays et aussi une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. La conférence d'aujourd'hui inclura aussi les mises à jour de la déclaration du Comité consultatif national de l'immunisation sur ses recommandations au sujet de l'utilisation des vaccins contre la COVID-19. Today, we will hear remarks from Dr. Theresa Tam, Dr. Howard Njoo, and Brigadier-General Krista Brodie from the Public Health Agency of Canada. They will be accompanied by Dr. Matthew Tunnis, Executive Secretary of the National Advisory Committee on Immunization Secretariat, and by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions du Dr. Theresa Tam, du Dr. Howard Njoo et du Brigadier-Général Krista Brodie de l'Agence de la santé publique du Canada. Ils seront accompagnés par le Dr. Matthew Tunnis, secrétaire exécutif du secrétariat du Comité consultatif national de l'immunisation, et de Joël Paquette de Services publics et approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Alors procédons. Let's begin. Over to you, Dr. Tam.
Thank you very much, and bonjour à toutes et tous. Thank you for joining us today for an update on Canada's COVID-19 vaccine rollout. My colleagues have been introduced by the moderator, so I thank them for being here today. This week, once again, we're seeing impressive numbers in vaccine coverage. More than 30 million doses have been administered to date, and as of June the 12th, 73% of the population in Canada aged 12 and older has rolled up their sleeves. As of June 11th, 2021, there have been 7,408 reports of adverse events following immunization. These include any medical events that occurs following immunization, but isn't necessarily related to the vaccine. 1,565 of these reports, about 1 in 18,000 doses administered, were considered serious, such as severe allergic reaction and vaccine-induced immune thrombotic thrombocytopenia, or VIT. Earlier today, the National Advisory Committee on Immunization, or NACI, released updated recommendations on first and second doses of COVID-19 vaccines authorized for use in Canada. NACI reviews new scientific evidence on COVID-19 vaccines on an ongoing basis and revises its guidance on the use of authorized vaccines accordingly. In making its recommendations, NACI considered the increased availability of messenger RNA vaccines in Canada, the emerging evidence suggesting better immune responses when a first dose of the AstraZeneca vaccine is followed by a second dose of the Pfizer, BioNTech, or Moderna mRNA vaccines, the risk of vaccine-induced immune thrombotic thrombocytopenia of VIT associated with the viral vector vaccines, but not associated with the mRNA vaccines, and principles of ethics, equity, feasibility, and acceptability. Based on the most recent evidence, NACI recommends that an mRNA vaccine, such as Pfizer-BioNTech or Moderna, should be offered to start a vaccine series unless there is a contraindication, for example, an allergy to one of the mRNA vaccine ingredients, or if an mRNA vaccine is not available. NACI's earlier recommendation that people who wanted earlier vaccinations could receive a viral vector vaccine rather than wait for an mRNA vaccine reflected the limited supply of mRNA vaccines at the time and the imperative of protecting vulnerable populations from serious illness and death during a time of resurgence of COVID-19. That recommendation has now evolved. For second doses, NACI recommends that individuals who received a first dose of an mRNA vaccine, such as Pfizer-BioNTech or Moderna, should be offered the same mRNA product for their second dose. If the same product is not readily available, or the product used for the first dose is unknown, another mRNA vaccine is considered interchangeable and should be offered to complete the series. In addition, an mRNA vaccine should now be offered as a second dose for individuals who received a first dose of AstraZeneca or COVID vaccine. This change is based on emerging evidence indicating a potentially better immune response from this mixed vaccine schedule and to mitigate the potential risk of VIT associated with viral vector vaccines. I wish to emphasize that people who receive 2 doses of AstraZeneca COVID vaccine can rest assured that the vaccine they receive provides good protection against infection and very good protection against severe disease and hospitalization. We are aware of and are closely monitoring reports of rare cases of myocarditis and pericarditis, heart inflammation, following vaccination with mRNA vaccines. NACI is closely following these reports, as are scientific experts at the Public Health Agency of Canada, Health Canada, and the provinces and territories. There is no clear association yet established between vaccination with an mRNA vaccine and this condition. As with all adverse events that are reported following vaccination, we work with our international research and public health colleagues to investigate thoroughly and take appropriate action if needed. I want to remind everyone that despite Canada's tremendous progress in getting people vaccinated, we are not out of the woods. We all need to complete a full vaccine series to give our immune systems the best possible shot at fighting off infection from COVID-19. So get that second dose as soon as it's offered to you. Thank you.
Bonjour tout le monde. Merci de vous joindre à nous aujourd'hui pour la mise à jour sur le déploiement des vaccins contre la COVID-19 au Canada. Je suis accompagné de la Dr. Theresa Tam, administratrice en chef de la santé publique du Canada, et de Madame le Brigadier-General Krista Brodie, vice-présidente des opérations de la logistique à l'Agence de la santé publique du Canada. Pour nous aider à répondre à vos questions, nous sommes accompagnés de Dr. Matthew Tunis du secrétariat du Comité consultatif national de l'immunisation et Joël Paquette des services publics et approvisionnement Canada. Cette semaine, nous observons une fois de plus des chiffres impressionnants en ce qui a trait à la couverture vaccinale. Plus de 30 millions de doses ont été administrées à ce jour et en date du 12 juin, 73% de la population du Canada âgée de 12 ans et plus avait retroussé ses manches. En date de 11 juin 2021, nous avons reçu 7 408 signalements d'effets secondaires suite à la vaccination. Cela comprend tout phénomène médical qui se produit après la vaccination, mais qui n'est pas nécessairement associé au vaccin. 1565 de ces signalements, soit environ un quart sur 18 000 doses administrées, concernent des effets secondaires considérés comme graves, notamment une réaction allergique grave ou une thrombocytopénie immunitaire thrombotique induite par le vaccin ou TIV. Plus tôt aujourd'hui, le Comité consultatif national de l'immunisation, ou CCNI, a publié des recommandations mises à jour sur la première et deuxième dose de vaccin contre la COVID-19 homologuées au Canada. Le CCNI examine des nouvelles preuves scientifiques sur les vaccins contre la COVID-19 de façon permanente et révise en conséquence ses directives sur l'utilisation des vaccins homologués. Pour formuler ces recommandations, le CCNI prend en considération la disponibilité croissante des vaccins à ARN messager au Canada, les preuves émergentes qui suggèrent une meilleure réponse immunitaire lorsqu'une première dose de vaccin AstraZeneca est suivie d'une seconde dose des vaccins à ARN messager Pfizer-BioNTech ou Moderna, et le risque de la thrombocytopénie thrombotique immunitaire induite par le vaccin ou TIV associé au vaccin à vecteurs viraux, mais non associé au vaccin et ARN messager. Et finalement, les principes d'éthique, d'équité, de faisabilité et d'acceptabilité. Sur la base des données les plus récentes, le CCNI recommande de proposer un vaccin à ARN messager tel que Pfizer-BioNTech ou Moderna pour commencer une série de vaccins, sauf en cas de contre-indication, par exemple une allergie à l'un des ingrédients du vaccin à ARN messager ou si un vaccin à ARN messager n'est pas disponible. La recommandation antérieure de CCNI, à savoir que les personnes qui souhaitaient être vaccinées plus tôt pouvaient recevoir un vaccin à vecteurs viraux plutôt que d'attendre un vaccin à ARN messager, reflétait l'offre limitée de vaccins à ARN messager à l'époque et l'impératif de protéger les populations vulnérables contre les maladies graves, les décès pendant une période de résurgence de COVID-19. Cette recommandation est maintenant évaluée. Pour les deuxièmes doses, le CCNI recommande que les personnes ayant reçu une première dose d'un vaccin à ARN messager, tel que Pfizer-BioNTech ou Moderna, se voient proposer le même produit à ARN messager pour leur deuxième dose. Si le même produit n'est pas facilement disponible ou si le produit utilisé pour la première dose est inconnu, un autre vaccin à ARN messager est considéré comme interchangeable et devrait être proposé pour compléter la série. En outre, un vaccin à ARN messager devrait désormais être proposé en deuxième dose aux personnes ayant reçu une première dose de vaccin AstraZeneca ou Covishield. Ce changement est basé sur des preuves émergentes indiquant une réponse immunitaire potentiellement meilleure avec ce schéma vaccinal mixte pour atténuer le risque de TIV associé aux vaccins à vecteurs viraux. Je tiens à souligner que les personnes qui ont reçu 2 doses du vaccin AstraZeneca ou Covishield peuvent être assurées que le vaccin qu'elles ont reçu offre une bonne protection contre l'infection et une très bonne protection contre les maladies graves et l'hospitalisation. Nous sommes en courant et suivons de près les signalements de rares cas de myocardite et de péricardite, inflammation du cœur suite à la vaccination avec des vaccins à ARN messager. Le CCNI suit de près ces signalements, tout comme les experts scientifiques de l'Agence de la santé publique du Canada, de Santé Canada et des provinces et territoires. Aucune association claire n'a encore été établie entre la vaccination avec un vaccin à ARN messager et cette affection. Comme pour tous les effets indésirables signalés à la suite d'une vaccination, nous collaborons avec nos collègues internationaux de la recherche et de la santé publique pour mener une enquête approfondie et prendre les mesures appropriées le cas échéant. Je tiens à rappeler à tous que, malgré les progrès considérables réalisés par le Canada en matière de vaccination, nous ne sommes pas sortis de l'auberge. Nous devons tous recevoir une série complète de vaccins pour donner à notre système immunitaire la meilleure chance possible de combattre l'infection par la COVID-19. Alors, recevez cette deuxième dose dès qu'elle vous est proposée. Merci. Et maintenant, j'invite le Brigadier-General Krista Brodie à présenter ses remarques.
To date, we have delivered more than 35 million doses of COVID-19 vaccines across Canada. This week's distribution of 2.4 million doses of Pfizer-BioNTech, our weekly shipment throughout the month of June, is complete. Yesterday, Pfizer-BioNTech informed us of an adjustment in its upcoming July shipments. They have committed to deliver the full number of doses expected for the month of July. However, we now expect lower allocations in early July and larger allocations later in July to offset. Projections for Moderna have increased since last Friday's announcement. Instead of 2 shipments from our Moderna supply arrangement, we are now receiving 3 shipments for a total of 8.5 million Moderna doses, a net increase of 1.5 million doses over what we announced last week. The first of those shipments arrived yesterday. The other 2 shipments are set to arrive in Canada on June 18th and 22nd. Allocation tables have been updated, and we are processing orders for the provinces in real time to distribute these doses as quickly as possible. We are also receiving a 4th shipment of 1 million doses of Moderna this week, as announced this morning by way of the U.S. dose-sharing agreement. These doses will be available for distribution to the provinces next week. These are significant changes from what I announced at last week's technical briefing, and there will be more changes to come as we work with manufacturers to confirm upcoming delivery schedules. Over the next 2 weeks, we are bringing in and distributing more than 14 million doses of the COVID-19 vaccines. This is the big lift. Vaccine supply is rapidly increasing. This allowed us to complete regular shipments to the territories last week and is allowing provincial jurisdictions to accelerate their programs. This week represents the single highest volume in terms of shipments and deliveries completed since we started distributing COVID-19 vaccines in December 2020. In a single week, we are bringing in more doses than we did in all of Q1. We are monitoring closely to ensure we match vaccine supply to anticipated demand as we track closer and closer in the coming weeks to having the appropriate number of doses available to fully immunize eligible Canadians. We are working tirelessly to ensure that we can vaccinate and protect as many people as possible, as quickly as possible. À ce jour, nous avons livré plus de 35 millions de doses de vaccins contre le COVID-19 au Canada. La distribution de 2,4 millions de doses de Pfizer-BioNTech, notre envoi hebdomadaire tout au long du mois de juin, est terminé pour cette semaine. Hier, Pfizer-BioNTech nous ont informé d'un ajustement dans leur prochaine livraison pour le mois de juillet. La compagnie s'est engagée à fournir la quantité totale de doses attendues pour le mois de juillet, mais nous prévoyons désormais des allocations le plus petites en début de juillet et des allocations plus importantes plus tard en juillet pour compenser. Les projections pour Moderna ont augmenté depuis l'annonce de vendredi dernier. Au lieu de 2 expéditions selon notre accord d'approvisionnement avec Moderna, nous recevons maintenant 3 expéditions pour une totale de 8,5 millions de doses de Moderna, une augmentation nette d'1,5 million de doses par rapport à ce que nous avons annoncé la semaine dernière. Le premier de ces envois est arrivé hier. Les 2 autres envois doivent arriver au Canada le 18 et 22 juin. Les tables d'allocation ont été mises à jour et nous traitons les commandes pour les provinces en temps réel afin de distribuer ces doses le plus rapidement possible. Nous recevons également cette semaine une 4e livraison d'1 million de doses de Moderna, tel que annoncé ce matin dans le cadre de l'accord américain de partage de doses. Ces doses seront disponibles pour distribution aux provinces la semaine prochaine. Ce sont des changements importants par rapport à ce que j'ai annoncé lors de la séance d'information de la semaine dernière. Il y aura aussi d'autres changements à venir, alors que nous travaillons avec les manufacturiers pour confirmer les calendriers de livraison à venir. Au cours des 2 prochaines semaines, nous allons recevoir et distribuer plus de 14 millions de doses de vaccins contre la COVID-19 au Canada. C'est la grande poussée. L'approvisionnement en vaccins augmente rapidement. Cela nous a permis de compléter les envois réguliers au territoire la semaine dernière et permet aux provinces d'accélérer leur programme. Cette semaine représente le volume le plus élevé d'envois et de livraisons effectués depuis que nous avons commencé à distribuer le vaccin contre le COVID-19 en décembre 2020. En une seule semaine, nous recevons plus de doses qu'au premier trimestre. Nous surveillons la situation de près pour nous assurer que l'offre de vaccins correspond à la demande prévue, alors que nous ferons un suivi de plus en plus serré au cours des prochaines semaines afin d'avoir la quantité appropriée de doses disponibles pour vacciner les Canadiens et les Canadiennes éligibles. Nous travaillons sans relâche pour nous assurer de pouvoir vacciner et protéger le plus grand nombre de personnes possible, le plus rapidement possible. Merci.
We will now open the phone line to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question de suivi. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you. Merci. Mia Robson with the Canadian Press. Please go ahead. À vous la parole.
Hi, my first question is for Dr. Tam. Just wondering if you could explain a little bit more what evidence NACI's new recommendations are based on. Did we see additional evidence and what's on studies that were showing a better immune response from getting a different second dose? And also if you could provide any updated details or data we have on VIT, particularly after a second dose in Canada, how many cases we have seen so far from after first and second doses.
Thank you for the question. So recalling that the last update that I did on behalf of NACI in terms of their recommendations was not that long ago. So what's happened in that interval that's resulted in an update to these recommendations? Well, there's just increasing numbers of studies, mostly from Germany, that we've accumulated in between that last set of recommendations and today's recommendations. And all of them essentially points towards the fact that it is safe to provide a mixed dose schedule that is after a first dose of AstraZeneca or COVID vaccine to be followed by a mRNA vaccine. But it's really the immunogenicity, that immune response after that mixed dose schedule that's resulted in NACI updating this recommendation because all of the accumulated study essentially suggests that that immune response is a better response. And of course, we will continue to monitor this in sort of the real life basis as vaccines are rolling up. But that's really not that there was at least 3 studies from Germany. And today we're just catching up to the 4th study from Germany, which essentially shows the same thing, that immune response, that antibody response, but also the cellular response, those T cells and other part of the cellular immune system performed very well and seems to have a superior response with that mixed schedule.
It's Dr. Njoo. I can maybe add to the question about VIT and the number of cases reported to date. As of June 13th, we've received a total of 56 sort of reports overall of blood clots associated with low platelets. And of those, 38 were also positive for the so-called anti-PF4, which meets the VIT definition. Certainly from the data we have to date, the majority are after only the one dose. So we don't really have sort of information with respect to second doses or sort of dose unspecified for a number of cases. So the majority of cases are really after the first dose, but we can certainly track back and see if there are any additional reports coming from the provinces and territories with respect to any, quote, VIT cases after a second dose. But at the present time, it's all related to first doses. Thank you.
Thank you. And I'm also wondering, Dr. Tam or Dr. Njoo, is there any suggestion yet that somebody who has had a transplant needs an additional dose of vaccine? I know there's been some discussion and study about whether 2 doses is not enough for that population. Just wondering if if there's any consideration for whether transplant recipients should get a 3rd shot sooner than sort of potentially boosters down the road.
Thank you for that question. That is an area of active investigation internationally. So NACI is following those studies very carefully. Of course, it would not be surprising to think that those who may have a suppressed immune system may generate a different or immune response after vaccination. So that is a really good question. At the moment, there is no specific update to the NACI recommendations, but this is an area of active analysis. And so we will, of course, update everyone should NACI make a recommendation in this space. But of course, just to add, there are many individuals in our communities who may not be able to get the vaccine because of underlying medical conditions, or who may not generate a great immune response even after 2 doses. This is why we need to all roll out our sleeves and get 2 doses of vaccine, not just for personal protection, but really to protect those around us who may not be well protected. Thank you.
Thank you, Dr. Tam. Next question. Prochaine question.
Thank you. Merci. Raymond Fillon avec TVA. Please go ahead. À vous la parole.
Merci. Question pour Dr. Njoo. Quelle est l'ampleur de la croissance des cas du variant Delta au pays? On entend parler de l'Ontario, mais et ça monte à l'échelle canadienne. Avez-vous des chiffres précis concernant la montée du variant Delta?
Merci pour la question. Moi, je ne suis pas au courant avec les chiffres exacts, mais on sait que partout dans le pays, on a signalé les cas avec le variant Delta. Et dans plusieurs provinces, par exemple en Ontario, ça devient, comme dire, la variant, la souche, comme dire, vraiment, comme dire, le plus important, parce que je pense qu'en Ontario, c'est presque 50% des nouveaux cas sont le variant Delta. Donc, c'est vraiment un enjeu important. On sait que le variant Delta est plus transmissible et aussi c'est aussi peut-être plus grave pour les conséquences. Donc, c'est quelque chose à suivre et on sait que toutes les provinces et territoires prennent l'enjeu pour le sérieux et c'est important de continuer avec notre surveillance. Mais pour souligner le point aussi de Dr. Tam, et on a répété ça plusieurs fois, que c'est très important de se faire vacciner avec les 2 doses pour compléter la série, parce que avec les études, par exemple, qu'est-ce qui se passe en Angleterre, on a trouvé qu'après 1 dose de vaccin, peut-être un certain niveau de protection contre le variant Delta, peut-être c'est seulement 30% et peut-être un peu plus, mais c'est beaucoup, beaucoup élevé avec une 2e dose. Donc, c'est très important ici au Canada de continuer à suivre les consignes sanitaires des autorités à l'échelle locale, mais aussi de vraiment se faire vacciner avec les 2 doses. Merci.
Oui, je peux ajouter que oui, il y avait 1941 cas de variant Delta qui a été reporté au Canada, but of course it may not be all the cases. Thank you.
Très bien, merci, Dr. Tam. Je reviens à Dr. Njoo. Dans l'optique où il y a des régions qui sont particulièrement touchées, dans la grande région de Toronto, est-ce que les gens devraient voyager d'une région à l'autre à ce moment-ci, compte tenu du variant Delta?
Oui, c'est une bonne question. On sait, c'est sûrement qu'on recommande encore de ne pas faire des voyages, les voyages, comment dire, à l'extérieur du Canada, non essentiels. Mais ici au Canada, c'est vraiment un enjeu, c'est important. Qu'est-ce qui se passe entre les provinces et territoires, mais aussi au sein des provinces et territoires. Et vous avez constaté que peut-être des régions chaudes, même dans la province, par exemple en Ontario. Donc, c'est toujours un enjeu pour les autorités à l'échelle locale. Je pense que c'est très important pour tous les résidents d'une région de suivre les consignes des autorités locales. Vraiment, dans les régions chaudes, je pense que c'est très important de peut-être limiter le nombre de contacts. Peut-être c'est aussi peut-être pas une bonne idée, peut-être de voyager partout si on est dans une région, mais je cède comme dit, les conseils à l'échelle locale. Et encore pour répéter le point le plus important, c'est toujours important de encourager tout le monde de compléter les séries avec les 2 doses de vaccin.
Merci beaucoup. Prochaine question. Next question.
Thank you. Merci. Dan Ralph with the Canadian Press. Please go ahead. À vous la parole.
Thank you very much. Dr. Njoo, if I may, if I could direct this question to you. The federal government's received the Canadian Football League's request for a national interest exemption for modified quarantine for the upcoming season, and I'm wondering where that might be, and as well as what the examination of the CFL's return to protocols might be, given that the league is looking at resuming play this year.
Okay, well, thank you very much for the question. I can remember getting this question last year, and I think we're in a sort of a different situation this year compared to last year, and much more, I think, encouraging. So I think in terms of the NIE, certainly with respect to players crossing the border and so on, I think the CFL has presented their protocols to us. We're obviously in the midst of examining them. But I would say that with the rate of vaccination throughout the country, I think the population as a whole is much more resilient, I would say, in terms of a good level of protection. I would say that the CFL has also given us good protocols in terms of, as you said, testing, maintaining the bubble. The other point I think that's very important is as well that we'll be following is the fact that the CFL games are basically played in outdoor stadiums. So that's already a good starting point with respect to the summer. Everyone's at least being outdoors. With respect to things such as spectators, capacity and so on, those are things that are going to be examined closely, not just by ourselves, but obviously by the provincial authorities as well, depending obviously on the epidemiology in their jurisdictions, and also as the vaccination rollout proceeds. And as we've said repeatedly, the more Canadians are vaccinated, and also as the epidemiological situation improves throughout the country, then I think we can see more and more, as you say, a return to, I wouldn't say completely normal life as before, but certainly a much better summer and a CFL season that we didn't have at all last year.
Yeah, and if I may follow up, they're talking about opening up training camp on the 10th of July and starting the season on the 5th of August. Given where you are with the review and examination of protocols, is that an equitable timeline? And what happens if if more time is required and we get into January 11th and 12th without approval of these protocols?
Sorry, I think I missed part of your question. You cut out a bit. I just understand that obviously time is of the essence. They have their proposed timeline in terms of training camps and the start of the season. I think certainly there are program staff within the agency are looking very carefully from a public health perspective, what the protocols are like. They're looking good. I can't give you a definitive sort of answer in terms of when they would be completing their review. And obviously there are other, departments as well that are probably involved in making the final decision. But I would say at the present time, things are trending in the right direction in terms of our review. But that's all I can say at this point.
Okay, so what I was asking, is there enough time to get it done by the 10th of July?
All I can say is we'll be making our best possible efforts, and I think everyone's working very hard to try and make this, as they say, win-win for everyone. But I can't really commit in terms of understanding some of the obviously very sort of a detailed, sort of analysis that the program staff here need to do.
Thank you, Dr. Njoo. Next question. Prochaine question.
Thank you. Merci. Our next question, notre prochaine question is from Ashley Burke with CBC News. Please go ahead. À vous la parole.
Hi, thank you for taking my question. My first question is for Mr. Annan. How many doses of AstraZeneca vaccine are still available in Canada, and what are you suggesting be done with that supply?
This is Joelle Paquette for PSPC. However, I will leave that question for General Brodie, given that she is responsible for the distribution throughout Canada. Thank you.
So at last count, there is approximately 600,000 doses of AstraZeneca still in Canada distributed throughout the provinces, and those will be used in accordance with the provincial plans. And understanding the evolving NACI recommendations, we continue to expect that the use of those vaccines will continue to evolve over the coming days. Thank you.
And what kinds of conversations are you having with officials in the United States right now about Canadians who have received AstraZeneca shots being acknowledged as vaccinated, and how open are U.S. officials to this idea?
It's Theresa Tam here. Conversations with the United States at both the technical and of course, at the more leadership level is ongoing. Those are some of the kinds of details that might be expected to be discussed. So, but I can't give you a specific answer at this point. But I would just like to point out that as Canadians, as people from Canada begin to travel anywhere in the world, you do have to look quite carefully at what the requirements might be of that country. At this point in time, when the world is only just beginning to open up and very few countries have been in a position where their population has been vaccinated, you're going to have to be a bit patient and do some research, because I think the world is evolving as we speak. And what is recommended 1 week might actually shift in real time. So that's the only advice I would be able to give at this point. Thank you.
Thank you. Prochaine question. Next question.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à tous. En fait, mes questions sont soit pour Mme Paquette ou la Brigadier-General Brodie. En fait, je cherchais peut-être à avoir plus de clarté sur les livraisons là, à venir en juillet de la part de Pfizer. Dans vos remarques d'ouverture, Mme Brodie, vous n'avez pas tout à fait dit qu'est-ce qu'on allait avoir par semaine. Donc, je ne sais pas si vous aviez plus de précision là-dessus, si vous pouviez peut-être nous donner une idée de combien de doses on va recevoir à chaque semaine au mois de juillet. Merci.
Donc, les allocations originaires étaient pour 2,3 millions de doses par semaine en juillet. Et maintenant, on a une allocation pour 900 000 doses pour la première semaine de juillet, la semaine de 5 juillet, et une allocation pour 1,4 million de doses pour la deuxième semaine de juillet, la semaine de 12 juillet. Et ça, c'est les allocations qu'on a maintenant, avec un engagement pour les pleins compléments de 9,1 millions de doses pour le mois de juillet. Merci.
Très bien, donc j'en comprends que vous n'avez pas encore à ce moment-ci les confirmations là, finalement des 2 dernières semaines de juillet pour Pfizer. Maintenant, sur Moderna, je veux juste m'assurer d'avoir les bons chiffres. Donc finalement, ce que vous nous dites, dans le fond, c'est qu'on va avoir donc 8,5 millions de doses de Moderna, 8,5 millions, oui, c'est ça, de doses de Moderna, en plus du million. Donc, si je comprends bien, on va avoir 9,5 millions de doses de Moderna en dedans de 6 jours, en dedans de 4 livraisons. Je me demandais si vous pouviez peut-être nous donner plus de clarté sur les livraisons, les chiffres qu'on a reçus hier, qu'on va recevoir le 18 juin et qu'on va recevoir aussi le 22 juin. Je ne sais pas si vous pouvez nous dire combien de millions à chaque fois on va recevoir. Merci.
Donc, entre les 3 livraisons qui viennent de notre arrangement d'approvisionnement régulière, on va avoir 8,5 millions de doses. Donc, la semaine passée, j'ai annoncé 7,1 avec 2 livraisons. Maintenant, c'est 8,5 avec 3 livraisons. Et en plus, on va recevoir 1 million de doses cette semaine qui viennent des États-Unis par rapport à l'arrangement de partager des doses avec les Américains. Donc, pour cette semaine, pour Moderna, c'est 8,5 plus 1 million. Donc, 9,5 en total pour cette semaine pour Moderna. Merci.
Merci beaucoup. Prochaine question.
Thank you. Merci. Once again, please press star 1 at this time if you have a question. De nouveau, veuillez appuyer sur étoile 1 si vous avez une question. Our next question, notre prochaine question, is from Annie Bergeron-Olivier avec CTV National News. Please go ahead. À vous la parole.
Hi, thank you for taking my question. I'm wondering what your message is to people who received 2 doses of AstraZeneca. Some people we've been talking to have received their second dose of AstraZeneca just minutes before your press conference. What is your message to those people who have continued to follow NACI's and Health Canada's advice regarding AstraZeneca, who now feel like they have been lied to, that they have been misled by your government, by NACI, by Health Canada, and are now confused, frustrated, and angry that once again the rules are changing?
Yes, this is Theresa Tam. So NACI's advice has evolved over time according to the available evidence. So I believe that the committee has been extremely transparent and extremely careful and be timely with the advice. And it is difficult, of course, working and in this environment of change, and also to catch up with the recommendations. So I totally recognize that this is difficult for many. But what I would say is that those who've received 2 doses of AstraZeneca COVID vaccine, you've been provided with good protection against infection. But more importantly, AstraZeneca vaccine provides good protection against severe illness and hospitalizations. I'll just point out that even with the Delta variant, of course, 2 doses of AstraZeneca vaccine is important. It's that second dose. Whichever vaccine you get, that second dose is important. So you just made a really good choice of having had that second dose. But 2 doses of AstraZeneca actually provides really good protection against hospitalization in the UK study against that Delta variant. So I think people should feel very comfortable that they've received the vaccine that provides them with that kind of protection.
Thank you. And my follow-up is, you just said that somebody who got 2 doses of AstraZeneca made a very good decision, that they are well protected. So why change the advice? And going along with that, there are some people with AstraZeneca who are already facing some challenges. Look at Bruce Springsteen concert in New York saying that people who have AstraZeneca are not allowed to go because it's not approved by the FDA. So what confidence do you have that people who get any type of a mixed dose, whether it's AstraZeneca mixing or who mix with Pfizer, will be allowed to travel to places like the U.S. and will not face barriers because of decisions that Canada has made?
It's Theresa Tam again. So I just want to emphasize that there is of course, the effectiveness from the 2-dose AstraZeneca or mixed dose. But one of the evolving evidence, of course, over time has been the observation of the rare but serious thrombosis event with low platelets. That, of course, played into the NACI advice. And that also is then balanced with the epidemiology of the time. And so it is a somewhat complex sort of way of looking at vaccine programs. But I think that Canadians have been extremely collaborative and patient with the evolving advice. So I do think that you've got your AstraZeneca vaccine. And these, rare side adverse events occur within a few weeks, and so I think that you should feel fine after that period has passed. These are rare events, but we want to make sure people know that they occur, and then when they get the informed consent, that that information is provided. So I believe the committee has been very transparent with that, and people shouldn't get a vaccine until they've understood or the important information that goes with that decision. The second question, I think, is a different question because every country has authorized different vaccines. So it's not just the United States. It could be different countries in Europe. It could be different countries in Asia. I mean, they're all making different policy decisions at the moment. So I think the important thing is engage in international discussions, whether they be the G7 or bilaterally the United States or others, to come to a point where we can accept each other's data, for example, and look at a path forwards that makes life, makes life easier, and that travelers are supported if they have been vaccinated. So I think that these discussions will continue. They will evolve. This is what happened to these individuals this week. That doesn't mean that the policy wouldn't evolve in the days to come. We are in the early days of resuming travel, and certainly in the early days of resuming travel, taking into account someone's vaccination status. But I think every one of us will do our best in looking at what can be achieved in the international discussions.
Thank you, Dr. Tam. That will be all for today's press conference. C'est ce qui met fin à la conférence de presse pour aujourd'hui. Any additional questions can be directed to Media Relations at Public Health Agency of Canada. Si vous avez d'autres questions, n'hésitez pas à communiquer avec le Bureau des relations avec les médias à l'Agence de la santé publique du Canada. Merci beaucoup et bonne fin de journée.